Test of Phonological Awareness by Kirsten Kelley. Identifying information. Test name. Test of Phonological Awareness. Publication date, 1994. Authors, Joseph K. Turgeson and Brian R. Bryant. Price, $250 for the TOPA version 2. Acronym, TOPA. Edition, first. Publisher, Pro ED Inc. Intended population, first and second grade students in early elementary school, ages 6 to 8, and kindergarten, ages 5 to 6. The purpose of this test was to identify children who need to receive special or supplemental training in phonological awareness. It is useful as part of a larger screening battery given routinely to all children entering kindergarten or first grade. The administration of the test should provide important information for further research. Components: examiner's manual, pencils, profile examiner record form, and student booklet. Standardization overview. Sample size. TOPA kindergarten was 857 children. TOPA early elementary was 3,654 children. Age ranges. Kindergarten 5 to 6, early elementary 6 to 8. Percent males for kindergarten was 49.8, for early elementary 51.1. Percent females, kindergarten 50.2, early elementary 48.9. Geographic regions sampled: Northeast, South, North Central, and West. Locations sampled were urban and rural. Racial ethnic characteristics. Kindergarten and early elementary race and ethnicities. Race was white, non-white, and other. Ethnicity, African American, Hispanic, Native American, Oriental, and other. SES distribution or education level. One test group was identified as having been from low-income families, low socioeconomic status, and were a racial minority. No subject characteristics were available. Validity. Overall, the TOPA needed to be constructed to result in a valid measure of children's response to the phonological formation of words. The item types applied by the TOPA assess the same underlying trait as other measures of phonological awareness. Performance on the TOPA is a remarkable predictor of variability in the way children react to instruction of phonological awareness. Analyses indicates the TOPA is not only an evaluation of sensitivity of phonemes similar in words, but also depends on a child's ability to isolate first or last phonemes in words. TOPA is representative of a careful and orderly procedure of item choice and analysis. Analytic and synthetic tasks contribute to content validity. Measures of analytic skills in kindergarten are correlated to skills in reading in first grade. Measures of explicit phonological awareness are demanding for most kindergartners. Kindergartners have little trouble with analytical sensitivity in the TOPA. TOPA has to be practical as a screening measure and requires a strong predictive correspondence to reading. Direct and indirect evidence support the predictive validity of the relationships to reading. Predictive validity may indicate which children score low on a predicted ability or skill. TOPA is administered once and then again at a later time for test-retest reliability. Test scores are paralleled or compared, and the coefficient outcome is the value of test-retest reliability. Reading instruction has an effect on phonological awareness. Administration basics. The test is administered in 15 to 20 minutes approximately. It can be completed in 1 or 2 sessions. It can be either individual or group setting. It is given in well-lit, quiet room free from distractions. The instructor familiarizes the students with purpose of test while encouraging them to perform their best, and the administrator should keep track of those students who seem distracted and record their names. Subtest descriptions. Subtest for the TOPA kindergarten. Subtest 1. Initial sound same. The students put their finger on a picture and they are given a stimulus word. The instructor gives 3 other pictures and students are prompted to identify the picture, one of the 3, that begins with the same sound as the stimulus word. It is repeated for multiple items. Subtest 2. Initial sound different. The instructor has students put their finger on a picture. The instructor says, "Look at the pictures," and gives 4 stimulus words. Students have to identify which stimulus word has a different first sound from the other 3 words given. It is repeated for multiple items. Subtest for the TOPA early elementary. Subtest 1. Ending sound same. The instructor has the students put their finger on a picture. The instructor says, "Look at the first picture." The first picture is, and gives a stimulus word. The instructor says what the other 3 pictures are, and students then identify the picture that ends with the same sound as the stimulus word. It is repeated from multiple items. Subtest 2. Ending sound different. The instructor has students listen for the last sounds in words and then pick the one word that has a different last sound. Students are prompted to put their finger on a picture, and the instructor says, "Look at the pictures," and gives 4 stimulus words. Students then identify which stimulus word ends with a different last sound than the other 3 words. It is repeated for multiple items. Scores: raw scores, percentile ranks, percentile scores, standard scores, and age equivalent, grade equivalent scores are all provided in the manual with the equivalent page numbers. Use: identify children to receive special or supplemental training in phonological awareness. It also may prove useful as part of a larger screening battery that is given routinely to all children entering kindergarten or first grade. The administration of this test should provide important information for further research. Preparation: the instructor should read over the manual prior to testing students. All testing materials need to be readily available, including pencils, extra sharpened ones, for students, and student booklets. Student seating is arranged in a specific way so that students are unable to copy one another's work. If this does not work, then during the test, the student administrator will provide blank white sheets of paper to those students and provide a demonstration of how one can cover their answers upon completion to minimize the events of cheating and/or copying. Limitations of the test. Both tests lasting 15 to 20 minutes, so the attention spans of students should be accounted for. Having children focus for 20 minutes in a group-type setting may be difficult. Setting up individual meetings with students for testing can be time-consuming. TOPA has to be administered by a qualified, eloquently spoken, and easily understood individual. Administrator cannot have an articulatory disorder or dialect, aside from the dialect of the children being tested, which therefore puts limits on who can administer this test and to whom they may administer it to. TOPA can also be completed in 1 or 2 sessions. There is an issue of students forgetting what was achieved in the first session and becoming uninterested in what needs to be completed in the second session. Lastly, cautions. One needs to take into account validity of the TOPA. Copying off of another student's paper, asking a student a question about the test, is not a reliable indication of a single student's ability. If students are not paying attention, engaged, or focused in the task, it could affect test results. In a group-type setting, the administrator of the test must be cautious about which students may become easily distracted, in addition to the students who may not want to pay attention or focus due to length of test and lost interest. Finally, the administrator should be mindful of word and phoneme pronunciation, making sure to correctly pronounce words and phonemes during the subtests of the TOPA.